Hello everyone. Good evening. I am going to get started. I'm going to pin the topic for tonight. Today's Wednesday again, and we're doing PCOS Wednesday. So welcome on in, and we're going to talk about the different types. So thanks for joining me again. Welcome. Hope everyone had a good Wednesday. I'm ready for a nap though, I'll be honest. All right, so we're going to get started, and we're going to definitely gain some information tonight that kind of pieces together a lot of what I've been doing for the past few months, right? I've been here for months doing this, and it's important to view PCOS. Good evening, hi, thank you. View it for the complex condition that it is, which is why we need to focus in a lot more on it. So tonight's topic really has to do with the fact that PCOS looks different for every woman. It's what I usually call an umbrella condition, where you are sort of standing under this umbrella of different shaped people, different ethnicities, but there are some common threads within that one condition that everyone shares, and it's hard to diagnose this as a result. So PCOS looks different for every woman. Polycystic ovarian syndrome was actually first described in 1935 by two scientists by the name of Stein and Leventhal. So in 1935, we're talking almost 90 years ago, they first realized this was an issue. And the problem with that is we're almost 90 years, 100 years out, and we really did not get much further in terms of what PCOS really means for women and what it suggests in terms of what you're at risk for. So it still is a pretty vague condition at this point in time in terms of defining it. It's thought to be very complex layers of genetics where you can inherit these things, and a lot more studies are needed for that. But we do know what the commonalities are, and that's what helps to piece together whether there's going to be a certain type of PCOS that you may suffer from as a woman, as opposed to someone else that's under that umbrella with you, also diagnosed with PCOS. So we know that it's an important cause of getting irregular periods, and there's different forms of periods that can be considered irregular as well. We know that it affects your ovulation, which does result in what we call reduced fertility or subfertility. So I don't like when people tell women with PCOS, oh, there's infertility and you'll never get pregnant. You absolutely can. With a little work and the right circumstances with PCOS, you can conceive, because there's reduced fertility or what we call subfertility. Obviously, there are elements of infertility as well too. Right, so, and then there's a collection of physical features related to androgen or male hormone excess as well. And then, so I'm listing off all these things for one condition, right? We have skin and hair features, which I've talked about on these lives, fertility, subfertility issues, and then these hormones also affect your metabolism, your weight and obesity and so forth. So it is recognized now, from 1935 to now, as the most common endocrine or metabolic disorder or hormonal imbalance that women suffer from, right? So that's PCOS. So it's a disorder of functional androgen excess, meaning I make extra male hormones and they're working and turning on things and doing things and they're functioning as a result. Again, complex genetic traits, so it's influenced by environmental factors. However, you more than likely, we now believe, carry genes for this that you've inherited, and then with the right or perfect storm, right? The diet you entail, the weight that you sort of live at, may now sort of allow that inherited possibility for PCOS to sort of manifest itself. But more significantly is within the genes that you inherit, the thinking now is that it's very complex in terms of how you inherit these genes. So the genes that they're looking at make you more susceptible to develop PCOS. These genes are the genes that regulate how male hormones are made. So you may have inherited that issue. And not only that, it may impact how the hormones affect how your pituitary produce what we call gonadotropins, which control your ovaries and your testes. You may inherit issues with that. And then on top of that, layers of diabetes and so forth. So, I'm going to put up a slide here that I hope no one kills me for it because we're not in school. We're not in school at all. And I just am going to explain using this slide. So let me send it now. The communication that I'm going to show between brain and ovary shows that there are many levels at which things can go wrong with one woman's cycle, which is why you may have a version of PCOS that doesn't look like anyone else's, right? So I'm going to send this image over, and it will look mostly familiar to most of us because it's a pair of ovaries and the uterus, and you can get to see what the differences are as well too. So while that's loading, 1 second, little technical difficulties here. I hope I don't lose the live. If I do, you guys, okay, no, I don't. Oh, okay, here we are. So this is what I'm speaking of when I talk about how complicated it would become when we're trying to define the different types of PCOS. So this image really is showing a woman's reproductive system, which is complicated. So when people say women are complicated, it's true. So it's a lot of chicken or the egg going on here as well too. But what you can see is with PCOS is there are different levels where communication can fall apart in terms of your brain telling your ovaries what to do, and then your ovaries telling your uterus what to do as well too. So this is where we're beginning this basis of trying to figure out where your issue is, on what level you're going to, sort of have issues with your ovulation process as well too. Now, it's complicated, but it's supposed to be basically the brain talking to ovaries, talking to uterus, and this falls out of sync. So with polycystic ovarian syndrome, the ovary now produces an abnormal amount of male hormones, which throws off ovulation. So the egg is supposed to travel through and release itself. Either you get fertilized and you get pregnant, or you don't. When that process is halted because the abnormal amount of male hormones are being produced, the ovary then develops these small little collection of fluids, what we call in the follicles, of fluid-filled sacs or cysts. So the actual term polycystic ovarian syndrome is confusing in that light because it's actually not ovarian cysts that would cause pain, and there are different types of cysts other than that you can get as well too. So the numerous fluid-filled sacs kind of form this ring that just throws off the entire environment for the ovary and how it's supposed to work. So here, this woman is not making enough hormones that are needed to ovulate. The ovaries develop numerous of these small follicles or fluid-filled cysts and fail to regularly release eggs as it should, or not as often, or not in a cyclic matter. So these cysts that, while they sit there now, are then adding to the problem by producing more male hormones as well too. So the exact cause of this is not clear, but at any point from the brain to the ovary to the rest of the body, PCOS could happen because something has been affected. So that's how we coming up with the different types, right? PCOS may also run in families. It's common for sisters to have it, mother and daughter as well too. So you got to chat with your mom and find out what things she may have had. Still working on the connection between aunts and grandmas, but definitely mothers and sisters. And of course, that goes along with risk of obesity and diabetes as well too. Right, so I'm going to take this guy off here. And what is important to say though is, if you have this increased number of cysts on an ultrasound, that is not enough to diagnose you with PCOS. If your doctor has diagnosed you with PCOS just based on an ultrasound and you have not had any blood testing done, seek a second opinion. You have not been diagnosed. You may have it for sure, right? But having the cysts on the ovaries that I just showed you really has not really aligned well with the actual diagnosis of PCOS. We do require other features as well too. So these increased number of follicles in some cases is quite normal in some women without PCOS, and then we see women with PCOS who may not have those cysts as well too. So it's something we see commonly, but it's not the diagnosis. So just remember me saying this: PCOS cannot be diagnosed by ultrasound alone. And if you have been told that you have PCOS and there hasn't been any blood testing or further evaluation, then you need to get a second opinion, right? So that's important. And it's also all of this that we're discussing, the complications of PCOS are quite significant. The complications of PCOS is what will affect you when you're in your 40s and 50s, and there wasn't any real attention being paid to what was happening with your body, except I was having these odd periods and facial acne and so forth. The complications, the list is long. There's infertility, or what I rather call subfertility or reduced fertility chances, gestational diabetes, so you're diabetic during a pregnancy, which can really have some complications in worst cases, including stillborn baby. Pregnancies with high blood pressure are linked to PCOS now. Miscarriages, I did a live on miscarriages, right? Miscarriages, you're at risk for that. Preemie babies, premature births. There's a syndrome called fatty liver that develops in your 30s and onwards, especially if you drink alcohol quite liberally, and then PCOS factors in there as well too. Metabolic syndrome is when one person has high blood pressure, high blood sugar, and high cholesterol. So it's a trifecta of things going on. And this significantly increased the risk of having heart attacks and so forth. PCOS is linked to that. Sleep apnea, depression, anxiety. You can tell me this stuff if it's too much. Eating disorders, bulimia, all of this direct links to polycystic ovarian syndrome. And of course, I didn't even touch on the fact that you bleed irregularly, so abnormal uterine bleeding. And ultimately, if not managed well, PCOS can lead to endometrial cancer. I had Dr. Pottinger on here. So it's all kind of pieced together in terms of all the risks that you face if you're not diagnosed and managed well. And even the management begins with you for most of the things, in terms of noticing your cycles and your diet and your weight and so forth. The genetics of it, we have started to accept. We inherit things, we can't really change that, but it's the environment and our nutritional choices that we have to pay attention to. So the exact cause is not known, but what we do know that women with PCOS make excess insulin. And the insulin situation really comes down to, it's like a bad Ferris wheel. So you make insulin, you eat food, your body's resistant or ignores your insulin. And then that, I'm going to send another slide over, and then that insulin situation keeps building up. And at excess insulin that's not being used, right? So insulin resistance. And this is one of the things we have known with PCOS, that is sort of this cycle that you're on. So excess insulin. So excess insulin increases production of male hormones ultimately as well too, and reduces ovulation and release of eggs. So with the excess insulin, let me just go here. Your cells in your body, every cell is supposed to bind insulin and use it. And the cells become more numb to the insulin, to the effects of the insulin, which then causes our pancreas to give us more insulin and give us more insulin until these cells recognize the insulin and start to use it until they get the message. The problem with that is you're not going to all of a sudden start recognizing the insulin. So that excess insulin now, that it's sort of causing changes in your body. So acanthosis, which is a darker, thick, velvety skin. One of my lives with Dr. Dolly, we addressed acanthosis, and the only way to reverse it, and get a better texture skin, it's in the folds of the neck and the armpits and so forth, is to work on this insulin resistance, which is where we would use insulin sensitizers such as metformin and so forth. So you eat food, which is what the slide is showing there. Then you make insulin. Then you really end up making excess insulin because your cells, as I said, are numb to it. And then all that sugar that wasn't burnt, because your body's ignoring your own insulin, has to be put somewhere. So I just ate, what did I just eat? I ate a donut, right? I ate a donut, pretty sweet item, processed sugar, simple carb, and needs to go somewhere. I ate this donut. So my body, parts of it that are working well, absorbs the sugar from the food. Sugar very easily crosses in through my intestines and it's in my bloodstream. My insulin now is released to burn that sugar from that donut I just ate. But I suffer from PCOS, or my family members are diabetic, or whatever my genetics are. My insulin, it doesn't have any impact on that sugar that I just ate. So my pancreas says, oh, really? Okay, more insulin. more insulin's there, still not working. The sugar now has to be put somewhere. So this is where you start getting what I call the little love handles and the belly fat, because this donut I just ate, I wasn't able to burn it. And the sugar is then stored in fat, or as fat rather. And then, because I didn't burn that donut, I'm actually tired. I'm even hungrier than when I first ate the donut, because my brain just did this weird, she ate, but we didn't really process the food, we just stored it away. And then I'm going to eat again. And that's when you end up craving sweets as well too. So if you think about this weird cycle that we stay on, exactly, it's quite cruel. And then when this insulin sits around, it's doing things to our skin. Acanthosis is along the cheek line, the neck, the armpits, and so forth. There are a few other things that it can impact as well too. But this is when I ate the donut, and then that same day I'm going to go try something else, because I really haven't satisfied any of my nutritional needs and I haven't metabolized anything. So I hope this hits home for some of you. If anyone has any questions or need me to explain this again, I can. But I felt that this was a simple way for me to put it out there as to how insulin-resistant PCOS impacts someone, right? Let's see here. Biology is such a strange but fascinating thing. Thanks for, absolutely. Obviously, I'm a bio freak, right? So yes, and it is. And it's really amazing how you're just walking around doing your mundane things, and your world, inner world, your brain and all these hormones are really on a whole other level in terms of how things function. So that's excess insulin as one of the reasons or causes that play a role that we've accepted with PCOS. So to understand the type of PCOS, you would start looking at this to understand the features that you sort of display and exhibit as well too as a result. So you got to watch those sweet tooth, sugar craving things that were like, oh, I have a sweet tooth. This is your sweet tooth chart, and it is not helping. Right, so a lot of times I would try to encourage clients to sort of switch their sugars. In that donut I said as an example, in this shot I ate this donut and then I still want more. So next thing you know, I'm eating another donut. You know, you're not really meeting your nutritional needs, and it's the excess insulin that's playing a role with this as well too. Another version of PCOS would be inflammatory changes within the body, or what we call low-grade inflammation. Now, I'll take this one off for now. Stop sharing. So inflammation. So inflammation, hi guys again. Inflammation is the term used for when your body's white blood cells are produced in larger amounts trying to fight something, fight an infection most times. So research has shown that women with PCOS may have a type of PCOS that's resulted from low-grade inflammation in the body. So they don't necessarily have the excess insulin like I just showed you in the slide, but they have inflamed ovaries that really are not acting the way they should, and they instead of producing our female hormones and our estrogen and balance with our progesterone, these ovaries, and ovulating, they start producing excess male hormones, which ultimately leads in this version to blood vessel issues, circulation issues, heart problems, heart disease later on in life. A lot more research is needed, but absolutely there is enough to say, well, there's a circulation thing going on here, there's inflammation, anti-inflammatory treatments need to be explored with that as well too. And then the next or the third type of PCOS or cause of PCOS is the inherited genetic, which I touched on, and again I'm going to say a lot of times tonight, more research is needed, but this is quite a bit in comparison to when it was first described, which was as far back as 1935, right? So when I try to really find concrete information about specific types or labels for PCOS, it varies. The nutritionists and the naturopaths and the herbalists and the dietitians, they have really sort of kind of come together with one accepted group of terms that they use. And then there's studies coming out of India as well too that show that there are specific types as well. There's no international sort of global consensus on this, but I think that we're getting there as well. So the Four types that we focus on if you're working in the realm of nutrition and dietitians and so forth. They look at insulin resistant, which I just spoke about, inflammatory PCOS, and then there's hidden cause PCOS, where this is where blood work comes to play. Again, if you've been told you have PCOS just based on the ultrasound, you're not fully diagnosed. You need to get blood work done, because hidden cause PCOS relates more to thyroid problems, a prolactin issue, sort of playing along with some of the PCOS features, but not the real issue at hand. So that's hidden cause. And then there's pill-induced PCOS as well too, where I've been on the birth control pill for whatever reasons. It's mostly irregular periods is most common, contraception. But then when I come off the pill, I actually suffer from more PCOS symptoms than I may have had before. So I'm going to touch on that as well too. And then there's PCOS related to our adrenal glands, which is called stress PCOS, which when I touch on that one, I feel a lot of women will be able to relate to that and didn't even realize that could have been a sign or version of PCOS, right? With the insulin resistance, which I talked about, most common type of PCOS, 70% of women tend to have this insulin resistant, insulin excess, which leads to more insulin being produced, and I'm not doing anything with it. The insulin resistance then results in much higher levels of circulating insulin, which causes changes in the body. I'm going to share another slide. Let's see here. This slide really just depicts what the classic, right, so this is an example of insulin resistant PCOS. So again, this tends to be the most common one that we would find. This is where I just spoke about your body becoming numb to insulin, and every cell in our body reacts to insulin. We need insulin to process our foods. So the cells become numb to the insulin. To check for this, you really would need to be screened for diabetes. I did a live called Know Your Numbers, right? Where you need to know your A1C number, your fasting glucose. But to really rule out insulin resistance, you also could or should get the fasting insulin level checked, because if you have high levels of fasting insulin, then this correlates to high levels of male hormone production, which leads to excess hair growth, male pattern hair loss, and acne. So in this slide, this individual would be struggling with her weight, not even knowing what next to do, because she is weight conscious and trying to lose, but it's just not going anywhere. And I just spoke about my donut as a bad example. But if you're insulin resistant, we're talking any simple sugar, fried baked bread. It's things that would really just seem like a normal, regular meal choice for you. When you're an insulin resistant person, that is going to accumulate with weight gain around that central area, which is quite difficult to lose unless if we are assisting the insulin in some way. It's hard to lose that type of central weight, and it's quite stubborn around the stomach or abdomen area. The sugar cravings I spoke about, and fatigue and brain fog, right? So I just showed you guys that one, which was the example of how insulin resistance actually pushes you to crave more sweet things. So you eat the food and then that cycles through. So this individual who is insulin resistant, these are the more common features, and that struggle with the weight, central obesity, the sugar cravings, fatigue, and brain fog really need to be screened for diabetes, get an A1C or glucose level, and a fasting insulin as well to sort of evaluate for this one. Right? So if anyone joining us has any questions or wants me to show a previous slide, I can. But this is one version or type of PCOS, which would be insulin resistant. And to treat this one, you really have to focus on improving your insulin sensitivity. Improving your insulin sensitivity means that I'm doing things to have my own insulin to work better. So my pancreas, which is going to get quite tired eventually of all of this as well, isn't chugging. I'm eating donuts, and my pancreas is trying to balance things and failing. All these symptoms hit home, but my A1C, etc. seems normal, which is great, Laurelie. The A1C being normal means that you are existing right now at a state where you're managing it to some extent. But as the symptoms persist, you definitely may need more assistance. in some other way or form, but the A1C being normal is just a great sign that you're actually not a diabetic, which is, it's just good. That's the goal. But as these symptoms persist, you really have to look as to whether you need to check a fasting insulin and see if that's elevated. And even though an A1C is normal, so you do, if it's a persisting problem, you do check back on these things as well too, right? And then we have another comment. Brain fog, yes. What does A1C mean? Okay, so the A1C, also known as hemoglobin A1C, you're welcome, my dear. The A1C number, to answer your question, is the percentage of the red blood cells running in your bloodstream within the last 90 days that were sort of covered with sugar. Red blood cells are very sticky. They take everything everywhere. Oxygen and nutrients and all these things flow in our red cells, with our red cells. So sugar sticks to the red blood cells. And the A1C is an assessment of the last 3 months of your life, sort of how you've been managing your sugars. And it's a percentage that gives us a great cutoff for who's normal, who's pre-diabetic, and who's diabetic as well too. And it could be done without being fasting, for, you know, how you would need to be fasting for routine sugar testing, right? So this is insulin resistant PCOS. Fixing it, you should try to improve your insulin sensitivity. I sound like a stock record, but I'm going to say it. You got to exercise. Exercise is hard and you're not always in the mood. But if you understand now that this is the best way to burn whatever you ate because your insulin is just not cutting it, you must exercise. Avoid high sugar foods. Avoid high sugar foods. You know, these are things that you can do long before coming into the doctor's office. Avoiding the high sugar foods, because when you're insulin resistant, you tend to crave sugar. So having a low carbohydrate diet that is rich in protein. So when you're hungry, and I learned this from one of the nutritionists that I use, Empower Nutrition, where we would always say that if you're craving or hungry, reach for protein before you reach for anything that's carbohydrate or sugar, because you actually will continue to feel more hunger after you've eaten that starch or that carb or that sugar. Whereas with protein, your body was actually needing the protein probably. So if you're in that zone of wanting to have something or craving, sugar cravings, then always reach for protein, maybe a protein shake. You can even do protein and fat, which would be more along some form of a protein with a good fat, avocado and so forth. That helps to balance your blood sugar levels better, and you're less reliant on your insulin that you're ignoring to try to fix the problem. So kind of reduce those sugars, and then you're sort of on the back end reducing your sugar cravings as well too. You need to prioritize sleep, that brain fog that you guys are all agreeing on. Most of us don't sleep the way our body needs. So you have to prioritize sleep and take cues, right? When your energy is fading or you've had a foggy day, that's when you turn the electronics off, not my life, but you turn your electronics off and you prioritize sleep and reduce your stress. And this also helps to balance sugar levels, because insulin is a stress response hormone, right? If I'm being chased through the jungles and I have to run further, insulin is one, just like cortisol, which also produces body fat. Insulin also is one of the stress response hormones as well too. So the blood sugar spikes and so forth. You want to reduce your stress throughout the day. And of course the supplements, I talk about those a lot. Herbs and supplements, magnesium, chromium, inositol, it's a good one for insulin resistance. So if you don't want to do diabetic medication or metformin and your workout isn't getting you the results that you're looking for, inositol is widely accepted now in most of the studies. Most of the herbalists and naturopaths and nutritionists and gynecologists, we're all agreeing that it can be extremely helpful. Another supplement is berberine. So if you're purchasing supplements online or you're looking in your vitamin shop, you may actually start seeing these blended in there as well too. And this information is quite well accepted as well. So now the next type of PCOS would be post-pill PCOS, right? So post-pill PCOS is PCOS that occurs in some people after they stop taking the birth control pill. And it really isn't clear how long you need to have been on the pill for that, but in this type, the symptoms of acne, irregular periods, excess hair growth that were not present prior to starting the pill at all in some people, becomes a feature for them after they've stopped the pill. It was found to be more prevalent in some types of pill, like Yaz, for example, and Yasmin, which have built-in ingredients to help with excess male hormones, which is why Yaz gives you that beautiful skin, and Yasmin as well. So when you stop these guys, you actually have sort of been suppressing your ovaries, and after coming off the pill, basically your ovaries just throw like a fat, they just throw a party, and all these hormones just flood in there, and you do get the very typical classic PCOS, which you never had after coming off the pill. But there's no insulin resistance, which means it's easier to reverse. And most times, I would say, calmate, it's okay. Let's ride out the next 3 to 6 months. Definitely treat the acne and the hair loss if it's there, but we expect this one to be able to reverse itself as you revert back to who you were initially. But it's hard to say whether you were going to get PCOS anyway, or whether the pill was actually masking the PCOS. But it has been established that stopping the pill can result in that as well too. But with the right nutrition and supplements and herbal support, it reverses, and it's not related to insulin excess, right? So that's the pill. And then the other type is what we call adrenal PCOS. So the adrenal glands sort of sit at the top of our kidneys like little snow caps, and they produce, oh my God, a complicated array of hormones that really, yeah, adrenals are important, but they should not play a role as much in how your ovaries work, because your ovaries are doing what they need to do. When you're stressed out, my previous example was being hunted and being chased through the forest, my adrenals kind of kick in, right? Flight or fright and all these things. So during stressful moments, periods will have a PCOS-like pattern to them, because the adrenals are sort of responding to all the stress you're under, and they now have an abnormal production of male hormones that would really on a good day not be the case. This is found to be about 10% of women with PCOS. More studies are needed, but this is that person who has high stress, the period stops coming. I relax, things are better. I have 3 month window where my periods are normal. And then when I'm stressed again, exams, new boss, old boyfriend, anything stressed me, my period takes a dip, and my periods are irregular at times of high stress due to this adrenal response. How do you even prove this one? During that time when I'm having this adrenal response, the adrenal produces a very specific type of male hormone, DHES, so that could be checked. I check it sometimes, but if you are not under stress right then, it's going to reflect as normal. So that's a tough one. So it's sort of like checking it during that moment of high stress to see if we can catch it being high as well, to kind of prove what it is. But in terms of this type of PCOS, because it's definitely not an insulin excess issue, and you're not struggling to sort of manage weight because the forces are against you with the insulin excess in terms of the weight, this also can be managed. And literally, it's that individual who needs to manage stress. Speak to a therapist, anxiety, sleep more, supplements, right? So vitamin C to support the immune system, pretty much your magnesium and all of your B's and everything that I always talk about as well too. Now, this adrenal PCOS is someone who also should avoid caffeine, coffee, tea. If you get stressed and your periods, take a walk whenever you're stressed. This is adrenal PCOS, and caffeine is not your friend, right? Inflammatory PCOS is one that is out there that I couldn't find a lot of information. I think it's pretty rare, and they really haven't sunk down onto whether it's PCOS or it's PMS, because it really has to talk about joint pain and headaches and neck aches and so forth. But this is in someone who does make excess testosterone and male hormones, and their type of PCOS, they have almost like skin issues and irritable bowel syndrome and eczema and joint pain, but really there's no cohesive way to really rule that in or out and test for that one, right? I will say it one more time, maybe I can share that slide. This is a slide of what the ultrasound looked like for polycystic ovaries, right? So the small fluid cell sacs are the follicles, and these don't sort of mature, so they sit there and they don't sit dormant, they sit there and they're doing things all day long, which is producing hormones. If you have been told that you have PCOS just based on a study like this, and you have not had any blood testing and you've not been evaluated, you need a second opinion, right? You need to book an appointment, probably with me, but you need to get reevaluated because this is not the only way to get it done. Okay? And you know, I think just looking at the different types here, I think that it's important to know that the condition I'm talking about was first described in 1935. It's still called all these different varying names. We still need all this information. We think Black people get it more, but then we think Asian and Indian women also get their own version. We have no idea. So it's important for us to start keeping our bodies in the forefront and checking out symptoms, getting evaluated, and understanding what version of this condition that might be affecting you, because remember, you also inherit it and you can pass it on as well too. Okay, so that's me in a nutshell, talking about the types of PCOS. I really think I tried to share some interesting information here this evening, and I think this slide I'm definitely going to put up because this is the one that explains why you crave sweet stuff. So I think this will hit home for anybody, whether you PCOS, male, female, everyone can actually have this issue. So it's important to understand. Just to recap this one, if you produce excess insulin or you're insulin resistant, the cells in your body become numb to your insulin, which is a very important hormone that every cell needs to sort of churn that food, burn that food into fuel. So I ate a donut, but I have insulin resistance. My donut now has pushed my pancreas to put even more insulin out there to try to burn this sugar I just ingested. And it doesn't work. So that sugar has to be packed away. The love handles, the jiggly bits, as Bridget Jones calls it, the jiggly bits. So there's pizza donuts being packed away because I couldn't burn it. And then after I've eaten this donut, shortly after, I'm hungry again because I haven't used anything for fuel. And I'm craving and I'm hungry and I'm not satisfied because I didn't burn. So I'm actually going to eat more food and I'm going to eat something sweet again too. So this is a good take-home one that I'm going to put up this evening as well too for you guys. Right? So does anyone have any questions or comments? Did you learn anything this evening? Let me know if you have any questions. And of course, I'm going to try to get this information up on our profile as well too. So if anyone has any questions, you can ask. If not, thank you all for joining in. This is PCOS Wednesday, and I'm really, really appreciative of the time you guys give me. Right? So have a good evening and stay safe.